Really appreciate the invitation, and I'm always willing to be a resource. Love parents as teachers. My kids have all been through it, worked with parent educators, and we've absolutely been appreciative of the help. Uh, and love being a part of the Wentzville School District. My kids are in the Wentzville School District, so we've got three kids, a first grader, sixth grader, and an eighth grader now. So he's waving. It's probably waving at you, Ashley, not me. You know, he doesn't care about me. So, well, just a quick introduction about myself then. I'm Dr. Jeffrey Lant. Call me JJ. That's what I go by. Uh, and so I am the optometrist at Four Circles Vision Therapy. We are a specialty optometry practice in the area. We're off of Highway K in O'Fallon, so not too far away from everywhere. Pretty easy to get to. And we do a little bit different type optometry than your normal eye doctor's office that you're going to for your routine exams, contacts or glasses, things like that. Most of our patients coming to us are referred from other eye doctors or teachers or parents as teachers, educators, for issues that go beyond just needing glasses or contact lenses. So tonight I've got a presentation that will show and kind of talk about a whole bunch of things that you might come across as parents that might lead to concerns, and what you should know about them and what you can do about them. And then we can talk for a little while about each of your kids and what they're doing and what you can help them do in order to develop good visual skills that were fantastic for motor development and pre-reading and all sorts of things that lead them to success going on. So with that, I'm going to go ahead and share my screen over with my presentation real quick. Let me blow that up. All right, everybody see that okay? Oh, there, perfect. Okay, so our slogan at our practice is learn to see and see to learn. So many of the concerns that I see, depending on the ages of the children, are based on really missed developmental milestones from earlier on. We see a lot of learning related concerns with kids that are 7, 8, 9, 10 years old. And when we do our analysis and evaluation, I often see problems that relate back to issues that they had earlier in life that were either not seen or not helped going together. So we'll kind of talk about that. But just like other skills, you have to learn how to do it first. And then once you can do it, it provides so much more for you. So I'm going to go through a couple kind of concepts and definitions real fast. I always love to pose this question. In every presentation I give, I ask this question: what is vision? When you think about vision, what is the first thing that you think of? I would dare say that 99% of people, when they think of vision, they're talking to what I call eyesight, what you can see, when you're at your eye doctor, you see, oh, can you see the letters on the chart down at the end of the room, kind of thing. And that's an important part of it, but there's so much more to it. So here is the definition by which I follow when it comes to vision. And I'll read this real slow because it's kind of dense as far as its meaning is. So vision is the deriving of meaning and direction of action as triggered by light. Light comes into our eye. Our brain somehow puts that light together in some sort of conscious image. And then based on the meaning that we get from that image, we then have to make some decisions what we're going to do about it. For example, you look out, you step outside your front door, and there's this large thing running towards you. It has big teeth and orange and black stripes. Previous experience is going to tell you that's a tiger. And if it's running towards you, you should probably go back inside your house and close your door, hoping that it doesn't break down the door. So you're using all sorts of, you're getting that meaning, and then you're able to make a decision as far as the direction. And it was vision that provided that whole process for you. Vision is the dominant process in our growth, development, and performance of a child. 80% of what a child learns is brought through the visual process. And this is, as we talk here more, we'll talk about what that visual process is, all those different abilities and skills that are important for us to develop as we're going along. So again, I talk about eyesight. That's an important part. but it's so much more than what you can see when you're looking at an eye chart. We gather that information, and based on our exploration for new information or our experience with previous information, we can then make a decision. And then you can have poor vision with 20/20 eyesight. Isn't that kind of strange to think about? Because it's all about what you do with it. So here's a kind of a guideline. Let me go through each one of these just within the first year of life. And if you've got any kiddos that are younger than a year, you can kind of watch these, and those that are above it, you can kind of use as milestones. But eye movements, when you've got an infant who's 2 to 3 months old, when they're brand new, they can see out about 6, maybe 9 inches out in front of their face. That's it. Beyond that, it's blurry. They can't see that. Their vision is very limited. Really, it's almost preset. You think it were on purpose, but if a mother were nursing, that baby can, from that distance right there, be able to look at the mother's face and be able to see the mother. And there's pre-programmed to see things like faces, recognize those. So they really draw attention to. If somebody comes into their view, they'll look at the face. It's a wonderful reflex that the child has. And then they're going to be able to start moving around and following things. So eye movements, what we call tracking, really begins to develop and come to its maturity, usually within about 2 to 3 months of life. What we call accommodation, or that's the focusing mechanism in your eye, is pretty similar. So now they can look at things up close. They can choose to focus on things far away. That depth will come into it. Again, most of us think that this happens when they come out and they can see already, but not quite. Those first couple months are critical as far as development. Contrast sensitivity. If you've ever used with an infant, a lot of the toys that you can find now are black and white, high contrast, and babies just find those fascinating. It doesn't even have to be anything but literally black and white bars, and they will stare at it like it's the most exciting thing in the world. That really develops and stimulates the visual cortex within the brain. A lot of people don't know this one, that color vision doesn't really start to kick in until 3 or 4 months old. Again, it's something we learn. Vision is learned, and that color vision is a part of that learning. Stereopsis, what we consider depth perception, being able to judge distance, usually doesn't come within about 6 months. And think about 6 months. What else is usually happening in a baby's life around 6 months? They might be getting to a point where they're starting to develop some motor skills, being able to move. Not long after this, they should maybe be creeping and crawling and moving around, and that's absolutely critical for them to have depth so they know what's up, what's down. Kids that don't have good depth perception are often afraid to move. They don't want to go upstairs. They don't want to go downstairs. They don't feel comfortable with that. So this one, to me in particular, is very important. If they don't develop this early, it can really cause a lot of delays later on. We already talked a little bit about eyesight or visual acuity. Adult-like eyesight doesn't kick in until about 8 months. So being able to look off to a long distance and see it clearly, it takes a while for that to come in. What we call, I put it in quotations there, refractive error. A lot of people call it an error, but really I don't view it that way. But the need of glasses, are they farsighted, nearsighted? So much is changing within that first year of life that few kids need glasses before then. And if they do, there's a lot of other stuff going on. But some of that stuff doesn't really kick in until that. So a lot is happening visually for the infants within the first year of life. A lot is happening for them in general. I mean, they're changing literally on a daily basis. They're changing on a monthly basis. So much is going on. So it's critical that within that first year of life that we provide them meaningful experiences that teach them how to use their eyes and how their vision can be a useful tool to them going forward in their life. So here are several different what I call essential vision skills. We've talked about eyesight already a whole bunch. If you kind of go to the right as you follow along that little diagram there, eye teaming, that's being able to use your eyes as a team as they follow things around, especially as they come closer and go further out. As a ball comes closer to them, rolling on the floor, they have to turn their eyes in and track it back out. This is a very, very important skill for them to do. Oftentimes what that will break down, and you'll see a kid that has an eye that turns out or a kid that has an eye that turns in. some strange things can happen when the eye teaming isn't developed. The third one here, eye focusing. We talked about that mechanism inside the eye being able to identify an object at a particular distance and autofocus your eye, just like our cameras do. Our eyes are amazing at doing that. That's a learned skill. It takes a little bit of time. Visual attention, being able to focus on something, know what's going on. If you are, I always use the example of needing to pull a splinter out of your finger. Your visual attention is going to be very, very narrow, right on that particular spot. If you're doing something like playing baseball or adults, if we're driving a car, your visual attention window is going to be wide open. You got to know what's going on all around you. Otherwise, you might crash into something or somebody. So being able to know when to focalize that attention in and when to open it up and be inflexible is a really important thing. A lot of kids developmentally can't do that, especially if you know children or worked with children, or if one of your children is on the autism spectrum. Sometimes those kids are just wide open. They can't turn it in, and they're just so distracted by everything going on around them, and they don't know how to focalize in on something. Or you have those kids that are just so attentive to detail, they couldn't care less what's going on around them, and just zero in on it. So working on the ability to have good visual attention is important. Visual processing is a big thing. We'll talk about that a little bit more as we go along here. What that means is what you do with that information. There's a lot of language integration, motor integration. So there can be a lot of connective problems there, dyslexia, dysgraphia, a lot of these other developmental concerns all correlate along with visual processing problems. Last one is eye tracking, being able to, again, fix and follow at something, follow it around. Oftentimes when your kids become readers, they might develop what some people call a tracking problem, and that's really kind of a misnomer. We'll talk more about it in a second. When you're reading, you're not really tracking anything. Your eyes are just moving along the page. It's not moving. Eye tracking is following a moving target, and being able to follow that. So we want all of these areas to develop these skills in order to have good vision. And again, eyesight is just one component of that. You can be really good here and not good elsewhere and technically have poor vision, depending on how you're looking at that. So let's talk now about several different signs to look for with toddlers and preschool age children that I want you to look for. I saw a mother just, I guess it was about 2 weeks ago. She came in and it was her parent as teacher's educator that told her about coming into our office. They came in for a free consultation, and she had noticed in some photographs that one of the eyes was a different reflex color than the other. You know, when you take a picture, you get that red eye effect. One of her eyes kept continuously showing up different, and even the pediatrician picked up on it. That can potentially mean a lot of things. It might be a lazy eye. Worst case scenario is there's actually a dangerous type of cancer that can show up that way, and that's where you would see it first, and that cancer can be life-threatening. So that was what the mother was afraid that it was, and luckily it was not that case. She actually just had a little bit of what we call astigmatism in the normal amount, so she was very happy to hear that it wasn't anything beyond that. But so look at your children, you know, do flash photography on your children. Look at that reflex to see if they're similar, and take photos from different angles, and that might give you an idea if there's any concern there. Drooping eyelids, especially one that comes down over the other, if you've got them off balance, that can be a sign of a couple neurological type problems. Of course, a big thing in my category is the misalignment of the eyes. If one eye is pointed in, one eye is drifting out, going up or down, that's a great thing. And those are usually pretty easy to detect. I have probably, you know, I don't know how many patients a week that come in and say, I've been noticing that this is happening to my child. What do we do? And there's so many options. A lot of kids will squint real hard or tilt their head to one side and do some really funny things when they're looking at things. Or I'll have parents tell me all the time that their kids will close their eyes to see things. And really what they're doing is avoiding using both eyes together, avoiding double vision, causing some problems. If you see your kids always rubbing their eyes or being real sensitive to light, blinking a whole bunch, those can be some red flags as well. watering eyes, infections that might come along with that. And then, of course, just failure to reach some of those milestones that go along. And as your pediatrician and your parent educators looking for those things, they can certainly have some vision-related problems there. So here's a couple tips to look for within your children. I want to spend some time now looking at some major vision problems that we come across, and I want to briefly describe their symptoms and what can cause them, so that way you can be on the lookout for these. And some of these you might have and you might understand this, but one of the most common visual problems out there is myopia, or commonly known as nearsightedness. What this means is that you typically complain of, I can't see things far away. So you might squint to have to do it. You're going to bring things in closer to do it. A kid in the classroom is going to say, I can't see the board. A kid at home might have to want to get really, really close to the television screen, or just bring things really far in. If mom and dad are both nearsighted, there's a 1 in 2 chance that that child is going to become nearsighted. So it's pretty likely to be passed along genetically. If one of the parents is nearsighted and the other's not, there's a 1 in 3 chance. If neither are, there's a 1 in 4 chance. So nearly half of the population has nearsightedness. It's a very common thing, and there's lots of things to do. So again, look for the problems at distance. What's interesting about this is really what this is, if you can see on my graphic here, is this is an adaptation dealing with near visual stress. The brain wants to see things easier up close, so it steals from the distance to make it easier. What do we notice as a symptom? The distance. Oftentimes the symptom is not where the problem is with a lot of things physically. So if a patient comes in and they are slightly nearsighted, not enough where it really bothers them yet, I might prescribe glasses that actually help them see better up close, and that reduces near stress, and you can have that nearsightedness start to fade away, or at least delay the onset or severity of it. I already talked about genetics. That plays a big role. So when nearsightedness drives in, what you're going to see is the cornea, if you can see on my screen there, the cornea steepens and the eyeball gets longer, so the focal point comes here. And so that's why it's blurry until you bring something in closer to you. So there's a physical change to the eyeball itself based on what's happening functionally to adapt to it. So the brain wants to do something better, so it changes its structure in order to do it better, but there's a cost. So then you give the person glasses to see better far away, and it tug and pulls until it finally finds its equilibrium point, usually in the late teenage years. The earlier the onset with myopia, the higher the prescription is usually going to be. The later the onset, usually the less the prescription is going to be. Okay, so if you've got questions about this one, there's lots of neat things we can do. We'll talk about that more in just a little bit. Next major one is farsightedness, kind of the other brother of nearsightedness. Typically, these kids don't complain of blur a lot, and if they do, it's mostly going to be up close. They can see far away, they can see up close, but they have to work really hard to do it. So there's going to be perhaps some headaches, some tired eyes going on, or you might see the eye actually turning in when they focus. This is, again, an adaptation. If it's too high, then it can cause problems, or if it's lopsided, if you have one eye that's more farsighted than the other, that causes a lot of issues like amblyopia or lazy eye that we'll get to here in just a second. Opposite effect, the eyeball is going to be short and the cornea is going to be flatter. And that's how it will physically adapt to it. Okay, I'll probably have heard of this word here, astigmatism, but nobody really knows what it means. And so what it means is that the curvature of the cornea and the length of the eyeball might not be symmetrical all the way around, so you get multiple focal points. And so that's going to cause somebody to kind of squint. They might get headaches. They can notice blur at far away or up close. It can happen, present itself in several different ways. Why somebody develops astigmatism is really some of those skills that we talked about, develop insufficient ways of dealing with it. If they have an eye focusing problem, eye teaming problem, they develop astigmatism to really kind of put some slop in the system so they don't have to do as much work. Again, it's a clever way of adapting, but it's not very effective in the long term. Genetics play a big role. Certain populations have higher predilections for astigmatism. So if you do, or if your spouse does, just like myopia or farsightedness, it can certainly be passed along. That's how you adapted, so therefore probably likely a way that your child is going to adapt as well. Okay, those are the three most what we call refractive problems. That the way the light is refracted throughout the eye, it can cause potential issues. So we always want to be able to look out for these. When you go to your routine eye exam, when you take your children in, these are the things that they're primarily looking for. Now it can go beyond that, and that's what I want to focus on now. A big one is what we call strabismus. This is the eyes turning, and you can see on my picture here, it should, eyes should be nice, center, straight ahead, or sometimes an eye can turn inward. We call that esotropia, or sometimes an eye can turn outward. That's called exotropia. Sometimes we see an eye turn up or an eye turn down. These ones aren't as common and are more associated with trauma or some other problems. But these two here, the horizontal ones, that turning in, turning out, are incredibly common. Probably at least 2 or 3 kids in every single classroom has some sort of concern like this. It can be one eye that is struggling more than the other. Oftentimes it's both eyes just can alternate back and forth, and the child just chooses to use one dominant one. But this is a coping mechanism, just like the other things we talked about, for dealing with some problems. It's an adaptation to avoid visual confusion, such as double vision or strain. Oops, sorry. So things to look for here. Obviously, the eye turning is the biggest thing. They might complain of double vision. They're not going to have good depth perception. Because of that depth perception loss, they're going to have delays in gross or fine motor skills. They're going to have a harder time judging where things are in space. They're going to have a harder time judging where they are in space. So a lot of times these real little kids, if they struggle here, they're not going to move. They're afraid of moving around. Then you've got the opposite. You've got some kids that literally just don't care, and they'll just bump into things all over the place. They're just going crazy, running into everything. You're like, didn't you see that there? That was kind of a big object. Again, they might not be perceiving that. Oftentimes, this will be when somebody closes one eye or turns their head to the side. Those are the kind of things that go along with this. But usually this is pretty easy to detect if the eyes are drifting in or drifting out. There is treatments for this that we'll talk about in a little bit. But those, again, the main thing is this is an adaptation. It very well can be genetic, can be passed along. If mom and dad or somebody down the line had an eye turn, likely that might be how the child decides to do that as well. Again, it's a subconscious way of avoiding the problem rather than dealing with the problem of using both eyes. It's not something they have, it's something they do. So I want you to think of something that they do. Look at there. She's got some cute glasses. Is that a boy or girl there? Sorry, I'm trying to, there you go.
It's a boy.
Boy, okay. I said my picture's real small though. What's his name?
Vincent.
Vincent, all right. So Vincent's got some glasses. I can tell he's farsighted just by the magnification from him there. Good. Does he have an eye that turns in any direction?
Yeah, it's mostly his left eye.
Okay.
Every now and then the right, but and it goes in.
Goes in. That's what I would guess. Yeah. So you're probably going to see one that's more so than the other. So he's kind of just like some people are right-handed to left-handed. He's going to have one eye that he prefers more than the other. So, but likely it's really down. It's not one good eye and one bad eye. It's a problem with both eyes and the brain using both of them there. So good. Vincent, you are a sharp-looking guy there. Thanks for joining us.
Say hi. Say hi.
Yeah, so I love to hear when I'm done here talking here, I love to hear a little bit about his story. Know what's going on there. So thanks for showing him to us. We'll keep him on so we can hear that cute voice. Okay, oftentimes confused with strabismus is what we call amblyopia. This is the common term for this is lazy eye, okay? Oftentimes people think a lazy eye is an eye that turns in or out. Technically, that is not correct. I really don't like this name lazy eye. I think it's really a poor description, but that's what people know and that's what people use. So what amblyopia is, that's the official name for it. It means that one or both of the eyes, for some reason, is having a poor eyesight due to something blocking it, due to development or something like that. Very commonly, a young kid could have congenital cataracts. The lenses in their eyes are cloudy and you can't see through them, so then they never get the visual stimulus. So that can be a problem. But most often or not, amblyopia is something that happens developmentally. Oftentimes what they'll do is, again, it's a two-eye thing. It's not one bad eye and one good eye. It's I don't know how to use both eyes together, so I'm going to actively ignore this eye, and oftentimes they'll make it really farsighted. They'll begin to use the brain to ignore that eye and just see well out of one. Same way is just a different way of, instead of turning the eye, they're just going to ignore it. So really the same, they're dealing with the situation of I can't use both eyes together in just a slightly different way, blurring it rather than turning it. So even when you give glasses to these kids, they may not see very well. It might help. And of course, you want to have the optimum prescription there to get help. And then you want to do more things after that. And we'll talk more about that in a second. Okay. So when people say lazy eye, we're usually referring to amblyopia. You can have both amblyopia and strabismus at the same time. That is possible. But technically, strabismus is not lazy eye. That's what people call it. Doesn't really matter too much, unless you're really into the semantics of it all, which I guess I would be. Okay, so we got strabismus and amblyopia. Really, really big developmental issues going on here. Here's a whole nother area that's a little bit higher functioning than either one of those. So visual skills dysfunctions, there's a lot of names we could call this. In my diagram here, if you can see that okay, so let's say somebody's trying to look at something up close. Their eyes are going to team in and position on that particular location. Sometimes the eyes will turn in too far. Sometimes the eyes can't turn in far enough, and they develop an eye teaming problem called, probably the most common thing I see is what's called convergence insufficiency. They can't bring their eyes in together. These kids complain of headaches. They have a short attention span. They have double vision sometimes. You see all these symptoms that go along with that. Sometimes, but looking at the kid, they look perfectly normal. You would never know there were a problem. In fact, a lot of times these problems are thought to be something else, like ADHD or ADD, and sometimes they are those things, but a lot of times this can complicate that situation and really, really give some troubles here. So we can teach, learn, and all this is just as a lack of development in the eye teaming and focusing that never became really accurate. It's not an inability, it's more of a uncoordination, or I don't know how to do that yet, even though I have the ability to do it. So very, very common, very easily overlooked. Even in a routine vision exam, something like this can easily be overlooked. I see it time and time again where they're having those particular problems. You do a couple different tests, and sure enough, here it is. And this could be just one component to a higher level developmental concern. Okay, so the two most common are what's called convergence excess, bringing your eyes in too close, or convergence insufficiency, not being able to bring them in close enough. There can be focusing visual skills. There can be, the eye teaming, the tracking, all those kind of are lumped into this. Two more things that I wanted to talk about. This one's very, very common and really hard to identify what it is. So a visual information processing dysfunction, or information processing, what's the other word I'm thinking of? I can't remember right now. So anyways, they can see fine, but what's happening in their brain? This is the kid that gets the B's and the D's and the P's confused. To them, you hold up let's say, for example, I'm going to hold up my son's shoe here, okay? Doesn't matter if it's facing this way, or this way, or this way, or this way. It's still a shoe. Well, think of it like a B, or a D, or a P, or a Q. It's the exact same shape. They're clever enough to realize that, but their brain hasn't quite realized that in our language, that actually has different meaning. So it really is an understanding of I don't know my right from left. I'm missing information cues. Has nothing to do with eyesight, but being able to process that information. So recognizing those differences in letter shapes and numbers and symbols, flipping their letters around. Oftentimes you think of dyslexia when it comes to reversals. Doesn't always have to be that way. That could simply be a visual processing problem. Memory, seeing things and recalling the memory patterns and sequences can be really, really tricky. Your kid, when you're teaching them to read and they learn a new word, 2 seconds later, they've already forgotten what that word is. That might be a visual processing problem. And handwriting, going from vision to sight, or sight to writing, visual verbal problems, being able to see something and then say it, or hear something and then see it when you write it out. All those things can be visual processing dysfunctions that you know, they may or may not need glasses for. They may have great eye teaming, but there can be some deeper things here that go into as far as some processing problems there. Okay. The other one I wanted to touch on is really a hot topic these days when we're doing all these Zoom calls and meetings and things like that. And we made up this thing called computer vision syndrome. Boy, this showed up in the 90s, and boy, we had no idea what was going to happen to us now. Usually you just used to be somebody who was a workaholic in the office would have computer vision syndrome. But nowadays, all my 3 kids are learning virtually from home. They're on the computer a lot. So they might have blurred vision, eye strain, redness, dryness, headaches. Depending on their posture, they're going to have some neck strain and things like that. Whether if they're on a computer, a phone, a tablet, this is a really, really big thing. And really it's caused from excessive visual stress at near, perhaps their posture. And of course, the big hot topic nowadays is this fatiguing light sources from screens called blue light. And I've got a couple solutions for you on that. Okay, so those are the main vision problems that I wanted to address, that I want you as parents and parent educators to be aware of, so that you can be looking out for those type of things. So how do you know if your kid has one of these problems? Sometimes it's pretty obvious. Sometimes it's not so obvious. So obviously we want to look for the signs and symptoms we talked about. Don't wait until your child complains of something. They might not know what's normal and abnormal. If they have one good eye that sees and one bad eye, they see perfectly fine. They don't know that there's a problem. They don't go around covering up their good eye. If they did that, they just uncover it. So it's, you don't want to wait till the problem comes. I hear it all the time. Oh, he's never complained of anything. He's probably just fine. That's a scary thing, because there can be a lot of things underneath there. So Parents as Teachers does a fantastic vision screening. Your pediatrician likely does something. The schools and the preschools will do something. So I highly encourage vision screenings. They can really flag some things. However, a vision screening does not replace a comprehensive vision exam. Okay, so here's kind of the timeline outlined by the American Optometric Association. They should have their first comprehensive eye exam between the ages of 6 to 12 months. Most people, like myself, participate in what's called the Infant C program, and that's a free eye exam. You don't have to pay a dime, and we providers will offer that to you, give you an idea where you're at, and get you started. If we see some concerns, obviously we can take it from there. If everything looks okay, then we plan on seeing the kid between ages 2 and 3, just doing another checkup there at that point. And then once they hit school age, kindergarten and beyond, we typically start seeing them on an annual basis, because their visual demands when they get to school skyrocket at that point. Oftentimes when these developmental milestones haven't been hit, like I mentioned earlier, they'll hit 2nd, 3rd, 4th grade, and they hit a wall. Something's going on, and the teacher says, I don't know what's wrong. It's an intelligent kid, but he's struggling with something. And a lot of times there's an underlying vision concern, like convergence insufficiency that you can't see, that allows them to gain that eye teaming and tracking ability back, and then they just take off from there. It's really fun to see that change. Okay, so that would be, the things to do. Be looking for things on your own, take advantage of screenings, and make sure that you get regular eye exams, comprehensive exams, in order to take a look at that. Let's identify each of those concerns. Here's some things you can do. If they have a refractive problem like nearsightedness, farsightedness, or astigmatism, typically the first choice is going to be glasses, or maybe contact lenses if needed. Now, something that I do a little bit differently than most optometrists or ophthalmologists, being in the vision therapy side of things, is a lot of times I offer 2 options. What we call compensatory. That's just, if you're nearsighted, I give you glasses, you can see better. That's what 99% of the time we're doing. But there can also be some therapeutic options there, where we try to reverse it or change the vision as a behavior, and we can get rid of the astigmatism or the nearsightedness, or cut it off before it becomes a problem. We just got approved. There's FDA approval now for this new brand of daily disposable contact lenses for children between 8 and 12 years old. If they're already slightly nearsighted, they can begin wearing these contact lenses, and it's clinically proven to reduce the amount of nearsightedness they develop over time. So if mom and dad are super nearsighted, chances are this kid might end up being that way too. you get them into a pair of contact lenses like these and they wear them, it's amazing how you can see that change. So they might end up, you know, a quarter of the nearsightedness they might have been had we not intervened and helped with that. Okay, so there are compensatory measures and there are therapeutic measures, and I like to give parents the choice. Every situation is a little bit different. Okay, strabismus, again, that's our eye turns. Sometimes, like in Vincent's case there, we needed some glasses to help us out, and that can be a big help, or contact lenses depending on the age and condition as well. I'm a little biased. Vision therapy, of course, is my favorite method of treatment for any sort of developmental, whether it's eye turn or lazy eye situation. We're working with the brain to develop all the visual skills all the way around, develop two eyes. Typically with strabismus, they might patch an eye, that can be a part of it, or they might do surgery. And I have to be careful if I'm stepping on toes. Surgery is not my first choice of treatment, but it's an option out there. A pediatric ophthalmologist, for example, probably is going to recommend surgery to realign the muscles. My take on that is if you're realigning the muscles, what you didn't do is tell the brain to do something different, and it likely will come back and just go right back to where it was. So most kids have 2, 3. I've met kids with 6 times that they've had strabismus surgery trying to fix it. The more times you cut on those muscles, the more it messes up the process. I have seen many situations where people have been very successful with surgery. If you combine the two, therapy and surgery together, just like physical therapy and surgery, orthopedic surgery, you're going to get great results from it. But you know, why go dig into the muscle if we can, you know, teach the brain to do it differently? Again, you know, I talk to parents who've had it done, and that's, you know, great thing. It's not a bad thing, but just so you know, there are options. Amblyopia or lazy eye, again, glasses are often needed in that situation. The most common thing to do is to wear a patch on the good eye so the less eye can see better, or they might use eye drops in the good eye so the less eye can have a chance to see better, and that helps. It does improve the visual acuity in those eyes. What it doesn't do, however, is address the underlying problem of I don't know how to use both eyes together. And so if you cover one eye, this eye never gets the chance to learn how to play with the other one. So the analogy I often use is think of it like you've got a bully and you've got a wimp. If you take the bully out of it, then the wimp gets to play and doesn't get bothered. But whenever you bring this guy back into it, that relationship never changed. So our vision therapy, what we do is teach them to be a team together. One method we do is anti-suppression methods. That's where they might wear some filter glasses where they've got a green lens over one eye and a red lens over another eye, and they play video games or certain card games or drawings where both eyes are participating and both eyes are providing essential detail, not just one compared to the other. So the brain learns to, hey, if I rely on both eyes, I get the bigger picture. Okay, so that's really fun to do, and it's amazing to see the results. They've said for a long time that amblyopia, once you're past age 7 or age 8, that it's too late to treat it, and that's definitely not the case. You can treat that at any age. It's harder to do later on, but it's never too late. Okay, the visual skills dysfunctions. Oftentimes those goes undiagnosed. Vision therapy is by far the best treatment or the only treatment for it. Eye movement problems, what we call oculomotor dysfunctions, accommodative function dysfunctions, that's the focusing, or those binocular functions of the eye teaming, all of that can be issues, and those are very high success rate treating with therapy. And once you kind of reprogram the brain to do it differently, you generally don't have those problems anymore. The information processing one is a really loaded topic, as I was kind of talking about there. So I highly recommend developmental testing through parents as teachers, through your school district, whether that's speech or motor skills, working with, you know, if there's a vision problem, we can do therapy vision-wise, doing some of that testing and screening with your occupational therapist through your school district. I highly recommend. Both of my boys went through speech therapy. Our second one, we figured it would just kind of work itself out, and it didn't. So he was in speech therapy for many years. And our second son started showing the same signs. We had him screened and tested very early on. He did speech therapy and was done with it before kindergarten and doesn't need it anymore. So taking advantages of the school system around you has wonderful resources. Sometimes you need to go a bit beyond that, and that's okay to do. but that's where those things are going to come. You want to be screened for dyslexia. You want to be screened for any sort of those processing disorders. And depending on the nature of it, vision therapy can help, or other therapy services can help out there. And then computer vision syndrome. Biggest thing, taking breaks. Got to give them breaks. Blue light filters or glasses, you've probably heard or seen those. If you go get eyeglasses from your eye doctor, you can get the option of blue light reflective, anti-reflective treatments on it. If you don't have glasses, you can get non-prescription blue light filters from Amazon for like $15. Or I recently discovered this on your devices, on your computer screen or your tablet or your phone, you can actually change and turn the blue light off. So you don't even have to have a filter that goes in front of it or wear glasses. Your screen itself can dim that down. So I can show you how to do that if there's interesting. Lighting is key. You want good lighting. Don't do it in a dark situation. You need ambient light around you. And of course, good posture is really, really important. That will help out there. Okay. So vision therapy, let me talk just briefly about that before we do some Q&A. But most people have never heard of vision therapy. And I'm the only one in St. Charles County that does it. There's a couple other offices within St. Louis that do it. It's one of those things that usually you don't know about until you might need it. And essentially what we do is we arrange conditions to provide the person with the opportunity and to have meaningful, necessary experiences develop that vision through learning and exploration. So just like other therapy services, it's practice. I really don't call it exercise, but you're practicing things in the same way that you might practice piano or yoga or something like that. It's something that you constantly do and constantly are improving and working on. So we have different treatment methods for different concerns. Again, I'm non-surgical. I oversee the therapy. I do a lot of it myself. I've got trained vision therapists, and this is helping people when glasses and contact lenses alone cannot do the trick and they need it. So here's some offices. We're on Highway K in O'Fallon, right by the O'Fallon YMCA. So we've been there for about 2.5 years now. So we're not super old, but it's been an awesome adventure. We've got all sorts of fun gadgets. 3D TVs and virtual reality stuff, and just some really, really cool things. We spent a lot of time on balance and timing and rhythm that all goes in a part of the whole system there. So, yep, and you can find us on Facebook or Instagram and kind of follow. We always give tips and different things, showing things what we're doing, so please check us out. Let me go ahead and turn the time back to you guys. I'll take as much time as you like to have any questions that you might have, and we can have a fun discussion. Love to hear about Vincent's story or any others that you might have. So if you want to chime in, go right ahead. Let me unshare the screen. Now we're back all the way together there. So anybody have anything out of the gates they want to ask or talk about?
I had a question. My son is going to be 3 in December, and he seems to have like a sensitivity to light.
Sure.
Mostly like, I guess when he's waking up from in the morning or whenever I turn on the light, or mostly like it used to be a lot in the car. And we got those sun visors in the back, even though the windows are already tinted.
Yeah.
With having blue eyes, does that affect more?
It definitely does. I was going to ask, what is his complexion? Is he fair-skinned and have blue eyes?
Yes.
That's the prime ingredient for light sensitivity, absolutely. The blue eye really is just an absence of pigment in their iris, and so it's like a clear window. That light just goes on through and just pounds on their retina.
Yeah.
The retina typically is very fair-skinned as well. Without that pigmentation, it doesn't have a lot to absorb it. So likely that's something over time he'll get better and better at. And so you want to, but a lot of people are just always, so I'd suggest if he's tolerant sensory-wise of sunglasses, just get some UV blocking sunglasses that he's comfortable wearing, whether they're Spider-Man or something, make it kind of a fun game for him and introduce it. I'd buy really inexpensive ones. That way, if you lose them or break them, it's no big deal.
We have a couple pairs we bought him.
Sure. And that's something that you hope over time that'll kind of fade away. But if you can have, like in his bedroom, like a light dimmer, bring the light on nice and slow rather than just that stark, turn the light on and everything's bright. There's ways that you can kind of accommodate to that. Not a lot you can really do to improve it, other than torturing him and just shining bright lights in his eyes all the time so he adapts really quick.
Okay.
Just kidding, don't do that. But yeah, great question. That's a common concern. And without you even saying it, I would have guessed that he's fair-skinned and blue-eyed. Yeah, by far the most common thing there. But sunglasses are your best friend, and you might notice that he needs them indoors in some situations. And later on, if he gets prescription glasses, kids do really, really well with the transition lenses, the ones that get darker when you go outside and get light when you go inside. That's a great option there too. Yeah, good question.
Thank you.
Mm-hmm.
Can you guys hear me?
We can, yes, go ahead.
So Vincent has lazy eye, which is why we're doing the glasses right now. I would say he got them like a month ago.
Oh, so brand new, good.
Yes.
He's how old again?
He just turned 10 months.
Okay, so real little. Mm-hmm.
So yeah, like right around the 9-month time frame is whenever we first took him and then got the glasses.
Mm-hmm.
I guess like right now, so as far as like developmental wise for him, motor wise, he's starting to walk behind walkers. So he'll push the walkers and kind of get those legs moving. He hasn't yet let go. But I'm trying to figure out what type of things would be good for him just so that those eyes are tracking the same. Like, is there certain toys or activities?
Yeah, great question. There's a lot of suggestions for that. So let me understand first. Obviously, he wears the glasses. He's farsighted. I imagine you said the eye was turning in, right? And it happens one a little bit more so than the other. Good. So really how that breaks down, in my opinion, from what you could tell, do you know if, it's hard to tell on somebody that young, is the vision between the two eyes different as well? What did the doctor tell you as far as that? Or could
it's not too much different between both eyes. He's just too farsighted.
Okay. Are there prescriptions in the eyes very different from each other? Is one stronger than the other?
No, they're about the same.
Good. That's a great thing. You want as much symmetry as possible. So activities that you can do with him, and some of this may be things that you're already doing, I would first ask, is he crawling? If he can walk behind something, I would assume he might be crawling. Mm-hmm. I would encourage him to crawl as much as possible. Don't worry about him walking yet. If he'll naturally pull himself up onto things, that's okay. If he wants to walk behind something, but I would put all of your movement effort into, both sides of the body. This is a bilateral thing. The eyes, again, I don't know how to use both eyes together. I might not know how to use both arms together. Movement of both sides of the body is fundamental to this. If at home you have some carpeted stairs that go upstairs or downstairs, I bet he loves it, but have him crawl up the stairs and then come back down and crawl back up the stairs. And the more he can crawl up the stairs, again, that really works that bilateral movement. As he gets a little bit older and starts to walk, when he's 2 or 3 years old, to encourage, again, the bilaterality. I'm a huge fan of the balance bikes, if you've ever seen those, where they don't have the pedals, using both sides, and then they're starting to develop balance. Kids that have esotropia, where the eye turns in, they are very scared of balance-based activities. A lot of kids older, they'll do something like a scooter, but if they have to balance like on a bicycle, so many of those kids never learn to ride a bicycle, and it's a shame. So the earlier you can introduce, where he has to balance both sides of his body, the better that's going to be for him. That'll be a huge thing for him there. So use both sides of the body as much as possible. Crawl. Then move on to things like, little things that he can sit on and kick with his legs and walk along, and then eventually get onto a balance bike, something like that when he's a little bit older. Okay, those are gross motor things that I would work on as well. Tracking, things like that, being able to do it. What you're going to want to do is, really have toys that he's interested in. It's something that makes noise. You can involve auditory feedback with it. Introduce things to him that he can reach out and grab. With esotropia, their depth perception is thrown off, and if it's out of grasp for them, they have a hard time judging that distance. So you want things at a close range that they can grab. Eventually, combine the movement with the grabbing. Take his toy, put it on the other side of the room, and you probably could do this now. Let him go get it. Let him see it, and let him make the movements to go get it, and then you'll see him stop and move and grab it. So it doesn't even have to be any sort of magic toy, just something that he's interested in. He's past the point where you need to worry about high contrast or anything like that. You know, a lot of those toys for infants, they're only like fluorescent colors, so they look nice to us adults, but the kid really only wants them to be black and white. You know, that's fine for them. But yeah, for about 10 months old, just see and get. You know, maybe squeak something so he hears it, he looks at it, he sees it, he goes and gets it. That's the kind of activity that I would do. Really, really good for developmental eye movements as well that we'll work with is tracking and eye teaming. If at home you have a swing, whether that's inside or outside, stand in front of him when he's on that swing and have him swing towards you. And his eyes, as they come closer to you, will converge. As he goes away, they'll come back. He'll get this movement. It goes in and out. He gets the vestibular involvement too because of the motion, and that, you know, that gets the visual vestibular connection really firing as well. Same thing can be with balls. You know, start with really big, roll the ball to him, have him roll it back, and then work your way down to smaller and smaller balls. Work on fine motor control and play different games in that way. There are a lot of other things that you know, that I could show you that are a little bit beyond just your mainstream toys and activities. We do a lot with kids with filtered glasses, like I mentioned, like a red lens or a green lens. There could be a ton of stuff that I could show you how to do. So if you're interested, we do, we wouldn't even need to necessarily do in-office vision therapy, but come on in sometime. We do a complimentary visit, and I could give you a ton of tools, show you where to find them, and give you a lot of things with the red-green stuff or the red-blue stuff that would be phenomenal for him early on in his development.
What exactly does the red and green?
Yeah, so there's nothing magic about the actual colors themselves, but when you have red and green lenses on, we have you look at things that have red and green on it as well. And so, for example, if you had a situation where it was say a 7-year-old and he was learning how to write, if he put those red and green glasses on, we put the red lens over his better seeing eye, and then he used a red crayon or a red pencil. The red cancels out that writing, so he can't actually see what he's writing, but he can still see his hand, he can still see the paper. That's so much better than just patching. The right eye's still there, but the left eye gets to see the detail. It actually sees what's being written, so it's the roles are kind of shifting. And this guy's normally in charge, this guy's usually along for the ride. We just switch the roles there so to develop that. Or you just do straight red-green things where one eye will see certain detail.
You're frozen. I don't know if
We've got these
there you are.
go eye, you know, the red eye will, am I back?
Yes.
Okay, my
Yes.
internet's unstable. Okay, so I don't know how much of that you heard there, but so we have like playing cards, like a Go Fish card, and it has red and green color on it. And so one eye will see certain part of the card and the other eye will see the other part of the card. So in order to see all the detail on that card that you need, both eyes have to be on. So it just ensures that both eyes are working at the same time. And if what happens if one eye isn't working, that area just blacks out. So the kid says, I can't see it, it's black. And that means they're not using that eye. So they have to figure out how to begin using both eyes together. So there's fun toys for younger kids that do the same thing. And of course, you get under some really fancy stuff later on. We call that, the red-green stuff, we call it monocular fixation in a binocular field. So one eye fixation, each eye is fixating on different things, but both eyes are in the same picture. Much, much more effective than just monocular patching or eye drops to do that. So are you guys doing any sort of patching at all or anything like that?
We are not yet. So we go back, not this weekend, next Saturday.
Right. Okay.
26. And
Who
then
is
we're
it,
supposed
if you don't mind me asking, who is it that you're seeing?
we're going to the Center for Vision and Learning.
Oh, great. Yeah. Wonderful.
Yeah, right off there off of Olive.
Perfect. Do you see Dr. Davidson or Dr. Shimbri or?
I don't know her last name. It's a pretty long one. I do know that.
Okay. So
I think it's the youngest one, like the
that might
newest.
be, that's probably Dr. Shimbri then. Yeah. So they are some of my best friends there. Yeah. Great practice. So they're going to be right along with those. Um, again, a lot of different eye doctors. If you were seeing a pediatric ophthalmologist, they might be talking about doing eye patching, things like that. And again, it's one way of doing it. It's kind of antiquated in my opinion. There are better ways of doing it. So there, Dr. Davidson's office at the Center for Vision Learning, perfect. Yeah, they're, it's them. There's another practice in Town and Country. The three of us are the main areas. And UMSL has in their optometry school, they do some. But the three of us practice is really focusing on that. So I love that. They are great. Really happy you're there.
So I guess like what we've been told is we're trying the glasses, then possibly patching. Like as far as like vision therapy, how early are you able to start that?
Sure. Well, it depends on, are they, I do a lot of stuff with first steps. So I see some pretty young kids and I'm working on those basic skills like we were just talking about, incorporating movement, incorporating where if your child's holding their head straight ahead, you have them fixate and follow on things so their eye muscles are moving in all directions. So you can do therapy. I don't treat it the same way as I do the older patients because that's a different situation. But yeah, you can do at-home vision therapy, directed by the office, or you can do in-office therapy as well. Great choice for you. I don't think they're going to mention or talk with you or push you on surgery. And I'm glad to hear that. As soon as you said the Center for Vision Learning, awesome choice.
Yeah, I would say
there.
that would be like our last resort.
Yeah, good. That's always, my last resort as well with those type of things.
So
you're in great hands
my
there.
husband has both strabismus and amblyopia.
Okay, so we know where it came from then.
Yes, so
Thanks,
we
Dad.
have all the boys tested and we
Good.
noticed it in Vincent. So
Good.
so we're hoping that since it's fairly early that we have more options than of course when he was younger.
Absolutely. And the nice thing is you can kind of ease your way into it. It's if you were coming into it at age 10 and he's been having this problem all along, you've got some unwinding to do. So he hasn't had time to form bad habits yet. What we're trying to do is provide the experience where he doesn't get a chance to, develop those bad visual habits of turning the eye in and beginning to ignore it more and more and more until it gets to a point where it's constant and all the time.
Mm-hmm.
We want it to be intermittent. We want it to be switching back and forth. And we want there to be time where you can tell that he's got both eyes straight ahead and you do that as much as possible.
Yeah, we've noticed a change already with the glasses.
Good.
So,
and depending on how farsighted he is, that may be something that over time he grows out of too. If he's really, really farsighted, any idea what his prescription strength is?
She said it was like 3.0.
Okay. Yeah. So that's definitely something that he might over time grow out of. If he's, plus 4, 5, 6, 7, yeah, he's going to be in glasses, going on. But I like the way that they prescribe similar to the way I do. You don't give them the full on prescription. You give the minimum amount that provides a benefit to them. If you do the full, when they do the eye drop eye exam, they get a much higher number sometimes. And if, in my opinion, if you prescribe all of that, it's going to be really tough on that kid to adapt to it, and it can kind of build more into it. So you got to be careful there.
My dog. She is nice, but she doesn't sound nice right now.
She's saying, I hear somebody that I don't like. What's going on there?
Yeah.
Good.
I mean, so I think we're on the right track.
I absolutely agree. Absolutely.
We'll try a lot of those things you said too.
Yeah. And just to, to piggyback off what they're doing, ask when you go in for your next appointment, say, hey, what can we do? Are we ready for, do we need to worry about red-green type stuff? When you soon as you say red-green, they'll know exactly what you're talking about and say,
okay,
can we introduce that now? When do we, what would be a good way to begin introducing that? I'm working with a little guy right now who has a cortical visual impairment. So he's only going to have so much vision because he's got some problems back there, but he has an eye that turns out. And right now we're using his red-green glasses like toys. We practice putting them on and taking them off and kind of going around and jumping on it, and just to begin building his familiarity with them. And then we'll begin doing 3D stuff later on once we get into it. But helping him see in three-dimensional visual things is by far the best. That's what the red and green is leading him to be able to do. Some parents, and I don't suggest this necessarily, but I've heard of parents going out and getting a 3D TV and letting their kids, interact with that. So that provides, that three-dimensional environment for them. It's artificial. Free space is always better than artificial space. But yeah, the more exposure they have to using both eyes together, the more it's going to make sense in the brain, and then they'll keep doing it.
We do have a 3D TV.
Well, there you go. Look at that.
I was like, what would you do? You just put the glasses on?
Yeah, if he'll tolerate the glasses, and cues that you would look for would be if he reaches out and tries to interact with the thing. So
wow.
If you ask him questions like, if you're watching, Thomas the Train or something like that, say, is he coming closer to you? Is he coming further away? Just see how he interacts with that space. And he might not be able to articulate it yet, of course, being only 10 months old, but you might see how he interacts with that space. So.
Oh, I think it's on the floor.
So.
Yeah,
Great.
well, thank you.
Yeah, thanks for sharing his experience. And again, I think you're in great hands. I don't know Dr. Shembri as well, but Dr. Davidson and I are close friends. We talk and message each other all the time. Love to share ideas. Yeah, we are in the same wavelength as far as what's going on. So you guys are in great hands there.
Okay, thank you.
Okay, so I have a question.
Please, yes.
I didn't think I would necessarily have one, but so I have lazy eye, but not the fancy word for it, sorry. My daughter also has it. So she is in 4th grade and and glasses. Hi, Ethan. Since 1st grade. But she struggles so much with what you were just saying with the letter B and D. Yeah. Like to the point where I'm really wondering that you brought that up. And
at 4th grade, that would be a concern. Yeah.
Yes. And line skipping. I mean, she really struggled with it a long time ago with B and D, to the point where her 1st grade teacher made us do this bed thing where B is for, and then D. But I still feel like when she's writing, she still really struggles distinguishing between those.
Sure.
So what kind of therapy, I know you were mentioning, with that's probably just something that has to be visual therapy, right?
It does. I mean, there's things that you can find all sorts of stuff online. I could tell you a couple websites that you go to and get free worksheets and different things that you can do. Really, the BP and Q is like what I was talking about. The little bed thing to me, it's a mnemonic device. It's simply a memory device. It's like right versus left. Well, you don't actually learn it. You just have some way of remembering it. So I like to get to the point where you actually know it versus.
Because they've never mentioned that at the eye doctor. We've had her, she gets eye screenings every year.
Sure.
She's been in glasses. This last time her prescription didn't have to change that much. But we are struggling really bad with headaches. And so I took her to the pediatrician. The last time we were at the eye doctor in January, I mentioned it. And they're like, well, her prescription hasn't changed. It's not going to change that much. It shouldn't be. But then when I went to the pediatrician, they're like, I really think you need to contact the eye doctor again, because maybe it's something with her eyes. And we're supposed to go see a neurologist too. So I guess I could see what you think and bring her in, and that might help. But
yeah, I'd love to take a look, and there's several, quick and easy tests that we can do to watch that. Tell me a little bit about her, does she have an eye turn, or is it the eye that doesn't see as well as the other?
So the eye doesn't see as well as the other. So she's like me, both of us have issues with our right eye. So they had hoped, putting her in glasses as young as they did, that she wouldn't have to wear them like I do now my whole life, because I didn't have glasses till I was in 3rd grade. So they've been kind of watching it to see. But yeah, that's what we're really struggling with, is just those, she just doesn't see those letters. And then when she was little, I mean, she would just run into things like cars and countertops and anything that was eye level. It's she didn't have that ability to depth, have the depth perception.
Sure. So all of that, when you're talking about, the lazy eye situations, the depth, how much of that is related to the visual processing those could be two separate things entirely, but they're all a part of vision as a whole. So you could touch on all of those bases with therapy. We would cover all of those, but you can get specific to, I'd be curious, with her amblyopia to see what level of vision she has.
And I can't tell you. I'd love to tell you what letter, but I don't know what number or anything.
The eye exams are going to look at, do they have healthy eyes, and what's the best acuity that we can get them to. When we talk together, we'll do several tests that I bet you've never seen your eye doctor do, that will give us an idea that actually there's an eye teaming problem going right along with it, and skipping lines and losing your place. That is so common to go along with this. And as we work with amblyopia, all those other skills come right along with it, and you'd be amazed. So whether visual processing, visual eye movements, focusing, all those things will flourish and come up. Did she wear a patch when she was younger at all?
No, she never wore a patch.
Just did the glasses, right? Okay.
Yeah. And I have a family that saw you that's like not related to PAT, but a friend of ours. And I can't for the life of me remember her name. But hers, I think both of her boys may have graduated from your thing. Because I a picture of them from graduating for doing your thing. I'm talking, please stop. Yes, he did. Please stop. He had to go somewhere. Sorry.
That's okay.
Kids everywhere. So yeah, but I forget. I'll remember their last names, but they were two boys, and I know he has glasses, but he did come and see you for a while. So I know you've done some great things with them because they were able to graduate from it.
Good, yeah. Well, it's I love some not all kids need to have intense in-office vision therapy. A lot of it can be directed at home, and there's some great programs that we can coach and do things on it. Something your daughter might enjoy. I just started working with this neat computer program that just became available in the U.S. It's called Amblyopia, and it's basically it's the red green, but it's red and blue, and they've got like 10 different games like Frogger and Tetris and things like that you play on an iPad or on a screen while wearing red and blue glasses. And it's customized to the kids. They earn things as they go along, and they can change their avatar and things like that. It's a blast. It's pretty inexpensive. 6-month access code is around $200. That's not inexpensive when you're thinking of an app or a game, but for what you're doing, that's a great price. So look at that. That might be something. And we come and talk about. That's a good thing to do. That's either pre-vision therapy, during vision therapy, great to supplement it, or great for those who have already gone past it and just want something to kind of keep the momentum. Doing some computer supplement vision therapy is really, really good. Obviously, that's not all that you need to do, but that's a great thing that will help with the amblyopia itself. With the B's, D's, P's, and Q's and that kind of stuff, that's a little bit specific. I'd want to know a little bit more about it. But yeah, come on in sometime. Be happy to.
Yeah, I'll have to.
So
my boys just got home, so they're going to continue to make.
Oh, you're fine. I can tell
we're beautiful though. We're real
beautiful. Cool. And say my boys are right over here. They're making all sorts of noise right now too. So.
So
awesome.
Dr. Lant, would you recommend going to an eye doctor first, or can we just come see you before that step? How do you recommend?
Sure. I'm not trying to steal anybody else's patients by any means. So if you or your families have a primary care eye doctor, yeah, go there first. Have this as in mind. They may, my biggest referral source is other eye care other eye doctors. But they may just send it, and know that there's a free consultation with us. If there's a big eye turn, or you already know the history, that there's lazy eye in the history or something like that going on, sure, come on, then you can kind of skip a step. Be happy to do that, and take a look at it. But I'm essentially view myself as an extension of the practices that I work with that refer patients to me. So we're all one and the same, helping each other out for the best interest of our kiddos out there. So. Okay, any other questions you guys might have?
Thank you so much, Dr.
Okay, you're
Lant.
welcome. Thank you. Please let me know when we can do it again. We can talk about all sorts of things. I can go on and on and on, as you can tell.
There's Ashley.
Hi.
Yeah.
Hi, Bubba. He's getting so big. I haven't been able to see them in person. It's so hard. We have to get a visit on
I
the
can
bus.
imagine that doing the virtual stuff is not easy.
No, it's not.
You don't
It's
get
hard.
much accomplished.
Right.
So.
So, all right. Thank you, Addie, for hosting. Great job.
Yeah, thanks so much.
Thank you. Thank you, Dr. Land.
You're welcome. We'll see you later. You guys have a good
Bye.
one. Take care.